China is facing a new health crisis, a new disease outbreak.
In 2001, it was first detected by Dutch scholars from the nasal pharyngeal aspirate samples of children with respiratory infections caused by unknown pathogens. A serological study shows that it has existed for at least 60 years.
A new disease outbreak.
It distributed around the world and is one of the common respiratory pathogens. This is your favorite half Chinese, and that woman that you saw before,
a new disease outbreak,
just was lying yet again. I hate to say it, young lady. I love all the religions and all the spirituality from India, but their so-called news sources, I have no idea why they keep lying. I guess they are less spiritual than the other ones living in India. Anyway, let's continue.
Which looks a lot like the Wuhan virus, and as always, Beijing is sharing no information.
And more lies. I have here from the National Institute for Viral Disease Control and Prevention, China, CDC. And they say here, everything you want to know about human metapneumovirus is here. Sorry, I probably butchered that name. I'm really bad with these kind of things. But interesting enough, this article is from 2023-609. So that is from July, right? Hard to say that Beijing is not sharing any information. By the way, they are sharing information. Otherwise, I couldn't read this from the Chinese CDC. But first, let's see what they are saying, because it's very interesting, and I will not say anything about this virus myself because I am not a doctor, and I think it would be irresponsible for me to give my opinion on what you should do or not should do. I'm just going to share what the CDC in China has to say about it. So first, they are talking about what is human metapneumovirus. Human metapneumovirus, HMPV, belongs to the family Pneumophyridae and the genus Metamovirus. It is an enveloped single-stranded negative-sense RNA virus. In 2001, it was first detected by Dutch scholars from nasopharyngeal aspirate samples of children with respiratory infections caused by unknown pathogens. Serological studies show that it has existed for at least 60 years. It distributed around the world and is one of the common respiratory pathogens. So it has been around since 60 years, and this lady is trying to make you think that it is just something new that's coming from China.
A new disease outbreak.
While the Dutch in my country already were aware of it since 2001 at least. Number 2, transmission and epidemic characteristics of human metapneumovirus. HMPV is mainly spread through coughing and sneezing. Transmission may also occur through close personal contact and touching virus contaminated surfaces and then touching the mouth, nose or eyes. Generally speaking, the incubation period after infection is about 3 to 5 days. The immune protection induced by HMPV is weak and repeated infections are common. HMPV is detected throughout the year with the highest detection rates in winter and spring. HMPV infection can also cause outbreaks. What is the mortality rate after the infection? Children, people with low immune functions, and the elderly are susceptible groups, and mixed infections with other respiratory viruses are common. It often causes common cold symptoms such as cough, fever, nasal congestions, and wheezing. In several cases, it can also cause bronchitis and pneumonia. In susceptible people with underlying medical conditions, HMPV infections can lead to death. Based on data from an article published in Last Global Health in 2021, you see, it's not that new, as this lady says.
A new disease outbreak.
1% of acute lower respiratory tract infection-related deaths in children under 5 years old can attribute it to HMPV. There is currently no vaccine or a specific medicine, and treatment measures are mostly symptomatic and supportive. 4. Epidemic trend on HMPV in Americans. Data from the National Respiratory and Enterovirus Surveillance System of the United States Centers of Disease Control and Prevention show that the detection rate of HMPV is in different regions of the United States reached a significant peak between January and April 2023.
A new disease outbreak.
During this period, the highest HMPV antigen and a nucleic acid positive rates in the United States were 19.4 respectively percent and 10.8%. The peak of HMPV epidemic in the United States this year occurred after the peak of influenza virus epidemic. See figure 2, that's this one. So there you can see it, what the data is. Here more. And then the last part, and then we continue on this video. Epidemic situation of human HMPV. I'm going to call it like that because I'm butchering the name. Analysis of respiratory infectious disease surveillance data from 2009 to 2019 by the Chinese Center for Disease Control and Prevention shows that among the 8 viruses that cause acute respiratory infections, HMPV ranks number 8. 2009 to 2019. And remember what she said?
A new disease outbreak.
Liar, liar, liar. With the positive rate of 4.1%, which is far lower than the 28.5% of influenza viruses from September 22 to April 2023.
A new disease outbreak.
The HMPV positive rate among hospitalized children with acute respiratory tract infections in Beijing was 2.6%, and there was no obvious epidemic peak. 6. How to prevent HMPV. Similar to prevention and control of other common respiratory viruses, the public should maintain a regular life and good attitude. No pharmaceutical intervention measures such as wearing masks in crowded environments or high-risk situations and washing hands and disinfecting frequently can effectively reduce HMPV infections.
They're calling it a pneumonia of unknown origin. That's how Chinese authorities have described it. Beijing says it has set up systems to monitor the outbreak. If you feel like you've heard this before, you have. From the same China, some 4 years back. They're making it sound like it's just the flu season.
The fastest response to any virus ever recorded in human history was in 2019 by China. The strictest lockdown ever recorded in human history was in 2019 by China. So again, this is a lie, young lady, and I really wonder if I still need to call you lady, because one of the threats of ladies is that ladies do not lie. You lie. How can you go home and face your children, if you have any, without any shame? I just wonder. And people, dear people, especially the ones in the neoliberal democracies, why do you accept that your media is constantly lying to you about the facts? Know one thing, if they are lying to you, you do not have a free choice because your choice has been manipulated. Therefore, they are not only undermining your democracy, but also undermining your free will. It is time for the people to stand up against this bunch of liars that are trying to sabotage our lives. Let me all know in the comment section what you all think of this. Please keep it respectful. We are not uncivilized liars like this young lady. I hope this was informative. If you liked the video, then please like, share, and if you have not yet, then follow. This was your favorite half Chinese, and as always, have a great day.